Hey, welcome back to Table Talk. Today we're going to talk a little bit about the different methods of chiropractic. There's more than one way to adjust the patient. Most people, when they think about chiropractic, they're thinking about, oh yeah, I'm going to get cracked. That's not really what we do, but I mean, yeah, obviously that's the kind of sound that it makes. But yeah, so that's one method of doing the adjustment is that we can go in there, we can adjust the patient, and yes, you will hear the cavitation. That's just gases being released, but the joint is then moving, and that's what we want. We want the joints to move, we want the nerves to be stimulated, and we need those the nerves to be reset. So that's one way to do it, and there are more than one technique in order to do just that way. So here at this office, we do mainly diversified. Sometimes we do Gonstead. And there are many other ways of doing it manually with our hands. Now, there is a tool that we can use as well. A lot of chiropractors do have this as well. This is using a spring-loaded instrument, and this is called an activator. And so with this, we can actually tap on the individual spinal levels with this based on the reactivity when we push and prod and we kind of figure what's going on. We'll tap and kind of reset those nerves this way. This is much more gentler. If we have patients that have maybe osteoporosis, maybe they have disc injury or some kind of like prosthesis, maybe we'll use this. There's also other methods to what we do. I also use this tool here, which is called an arthrostem, and it does do something very similar to the activator, but it is a little bit different. It kind of vibrates as opposed to just giving one little impulse in there. But this is another way that we can use to stimulate the joints. And then another way is and a lot of chiropractors have this as well. These tables, some of them, have pieces that pop up and pop down, which help us deliver the adjustment also a little bit more quicker. And that also makes it so it's a lot more gentler, so to speak. So we'll come in here, we'll kind of pop the table up, we'll come in here, we'll deliver that force, and you'll hear it kind of pop down. That sounds nice and noisy, and you might not feel the cavitation because it is a lot quicker, and so it does help us to make those corrections. It's all based on patient need, especially here at our office, but there is more than one way to deliver the adjustment. So just because you had a bad experience at some place doesn't mean you always have a bad experience. And it's the same thing with dentistry or your hairdresser or whatever. You're going to find somebody you really like, and you're probably going to stick with them. So just hopefully this is educational. You'll get a little bit more information. We'll keep giving you more health tips. Take care, guys.